everyone. In this presentation, we will be discussed on the case study which involving the strategic planning or decision making. First of all, let us introduce ourselves. I'm Xiaoying.
I'm Alisha.
I'm Yamuna.
So today we will be discussing about the laboratory safety and compliance. In our case scenario, you are the safety officer in a research laboratory that works with hazardous chemical and biological agent. There have been instances of safety violation and non-compliance with safety regulations. So your task is to ensure laboratory safety and compliance with applicable standards. So as the designated safety officer, you bear the primary responsibility for laboratory safety. Your role is to ensure that all operations within the laboratory, whether dealing with the hazardous chemical or biological agent, are conducted in a safe manner. You must always maintain the compliance with both institutional and broader safety standards, including the national and international regulation. Your leadership is fundamental to cultivating the culture of safety and accountability in the workspace. So this role, it requires a specialized expertise in identifying chemical and biological hazards, performing risk assessment, and applying best practice for the laboratory safety management. You must develop the comprehensive safety policies, conduct the periodic inspections and safety training, and serve as the main point of the contact between the laboratory and the regulatory bodies. So one of the key tasks is to enforce the laboratory safety and compliance, ensuring that every activity meets the relevant safety standard established by the local and international authorities. Adherence to the protocol and proactive risk management are critical for effective safety oversight. So a little bit about the overview of the laboratory safety setting. The modern research laboratory environment is defined by the presence of hazardous substance and advanced technological equipment. Managing these risks demands rigorous hazard identifications, strategic risk mitigation, and detailed contingency planning. By maintaining a vigilant approach as a safety officer, you need to help reduce the exposure risks and promote a culture of continuous improvement in laboratory management. However, there are several challenges often undermine laboratory safety that have been identified in our environment, and these include insufficient safety training and awareness among the staff. Many laboratory incidents are linked to inadequate hazard recognitions and periodic lapses in training, especially in dynamic research environment where risks change frequently. Second, there's a problem with complacency and deficiency in safety culture. When the personal accountability and supervisory follow-up are lacking, the safety rules are easily overlooked. So this is particularly true when the routine tasks become normalized and making the staff less vigilant over time. Third is the improper chemical and biological agent management is a recurring challenge. For example, failure in labeling chemicals, improper disposal of the waste, and unsafe storage of the hazardous agents often appear in compliance audits and pose significant risks. Another issue is the non-compliance with personal protective equipment, or we call it as PPE. Although PPE is essential, its consistent use remains an issue where the staff member sometimes they will neglect the liability codes, gloves, and vital eye and face protections, which will increase the risk of exposure to hazardous substance. Lastly, is the equipment maintenance gaps have been observed like the outdated or malfunctioning of fume hoods, safety shower, and other emergency equipment directly will affect our ability to manage the accidental exposure effectively, making it quick and safe responses are more difficult. So each of these issues will represent a potential threat to laboratory safety and must be addressed systematically. So now we look at some real examples of safety violation and non-compliance that have been documented in the laboratory environment. So first, there have been cases where inadequate storage and mislabeling will lead to the accidental release of toxic vapors in the university laboratories. For instance, 2023 review of laboratory chemical accidents cases, it highlights that such incidents will emphasize the risks associated with poor labeling and insufficient container management. Secondly, the poor adherence to biosafety standards and the lack of documented risk assessment have led to the significant incidents, especially in biological laboratories. So these incidents often result in exposure events as detailed in national guideline audits, showing that neglecting biosafety protocol can have serious consequences. Another common violations involve the repeated improper disposal of the hazardous waste. For example, some studies have noted that incompatible chemicals are often mixed with the general trash, or that biological sharp and the contaminated material are not segregated correctly. So this practice will greatly increase the risk of both chemical reactions and biological hazard. And then finally, several accidents have occurred because staff fail to follow the established standard operating procedure, the SOP. So this includes making an unauthorized change to protocol without first seeking supervisor approval. Such lapses it will demonstrate how critical it is to consistently follow the SOP to maintain the laboratory safety. So this example, it underlines why the strict compliance with safety guidelines, proper training, and robust supervision are essential in every laboratories. So now let me explain about the root cause of safety challenges in laboratory environment. First, the human factor, such as inexperience and insufficient training, it play a major role. When the staff are not properly trained or lose sign of safety principle over time, the likelihood of the accident and mistake will increase. Secondly, safety management deficiencies like infrequent safety audits and lack of visible leadership compound the problem. This is because without the proactive management and leadership, it becomes difficult to maintain and improve the safety standard. Third is laboratory may also suffer from the inadequate infrastructure and limited source and poor communication practice. All this is making the incident more dangerous and harder to manage. Finally, ineffective transmission of the safety information and unclear responsibility can lead to the delayed responses to hazard and increased risk. So there are several key factors that contribute to laboratory safety challenges. The first major contributor is the laboratory environment itself, because high staff turnover, intense research pressure, and diverse hazard profile increase the complexity and the overall exposure risks in laboratory operations. This dynamic condition make it more difficult to maintain consistent safety practice. And then next, protocol deficiency also play a critical role, because when standard operating procedures are outdated, risk assessment are not regularly performed, or even documentation lacks occur, unsafe practice are allowed to persist unchecked. So ensuring that the protocol are current and strictly followed is essential for the safe working environment. And then the third one is staff training is another crucial factor, because many lack experience gaps in orientation for new staff or students, and limited refresher training will lead to the knowledge decay over time. So poor compliance can often be traced back to inadequate training and a lack of ongoing education about the safety procedures. Finally, our monitoring system need improvement. So with incident reporting structure and insufficient analysis of past incident, it greatly reduces the opportunity for systemic learning and continuous improvement. So robust monitoring and feedback system are vital to identifying the risks, the sharing lessons, and prevent the future safety breaches. So collectively, these all contributing factors will highlight the importance of strong protocols, ongoing staff education, effective monitoring system, and an adaptable environment in maintaining the laboratory safety. Next, I will pass to Aisha.
So, to address the major issue identified in our laboratory, our team have proposed a comprehensive set of solutions that aim to achieve full compliances and safe working environment. So the first one, we propose to develop and enforce comprehensive safety protocols. This protocol will include detailed guidelines on personal protective equipment use, proper handling and storage hazardous material, and clear procedure for chemical and biological waste disposal. So having this documented and communicated to all the staff will ensure that everyone understand and follow the same safety standards. The second one is providing a mandatory training and education for all laboratory personnel. So training session will be cover hazard identification, the safe use of PPE, and emergency response. Refresher courses will held regularly in ensuring that everyone remains up to date with new regulation and procedures. The third one is having a routine safety audits and inspection. These checks will help identify unsafe behavior or non-compliance early and allow for prompt corrective action. It also keeps accountability and informs the continuous improvement mindset. Next, we will ensure the availability and maintenance of all safety equipment such as the fume hoods, eye wash stations, spill kits, and protective gears. The regular maintenance will ensure that these items are functional and ready to use in emergencies. So next is to promote a strong safety culture and leadership commitment, which is the standard operating procedure. So for all labs, standard operating procedure for all labs and activity are needed in order to have a regular review and updates with strict adherence by all the staff. And then lastly, establishing a clear reporting and incidents investigation procedure. So in this, immediate reporting of any violence or exposure will allow us to investigate thoroughly, document the findings, and prevent similar incident from happening again. So next, each of the proposed solution is backed by the research and proven safety management principle, which is the justification of the solution. So developing and enforcing safety protocol is critical because high compliance directly reduce risk and accidents, which study shows that when safety compliance rates exceed 90%, hazard recognition of emergency preparedness improves significantly. Next is the use of the Standard Operating Procedure or SOP, ensures consistent safety practice and adherence to regulation. SOPs help minimize variability in hazardous material are handled, which in return reduce potential safety risks. Next, the mandatory training is justified because it improves staff knowledge and awareness of hazards. Research shows that well-trained personnel have fewer accidents and are better prepared for emergency response. Next is having a strong safety culture and leadership involvement have been proven to enhance safety performance. When the staff feel safe to report incidents and know their leaders prioritize safety, so overall the compliances and morale will be improved. So next is the regular safety audits and inspections are essential for early detections of hazard. Study in safety management system demonstrates that consistent auditing increases accountability and leads to continuous improvement. Next is the ensuring availability and maintenance of safety equipment is another key justification. Like functional PPE and emergency tools are directly linked to lower injuries rate and faster response during accident. And finally, a clear reporting and investigation system foster a culture of learning where transparent reporting allows organizations to analyze the root causes of accidents and prevent recurrences. Therefore, this helps strengthening long-term safety compliances. So that's all for me. Now I pass it to Yamuna.
Implementation plan. Our team designed a structured plan to improve laboratory safety and ensure compliance with all applicable standards. This plan focuses on 8 key steps. The first one is audit and identify risks. The first step is to conduct a true audit to review current safety practices and identify areas of non-compliance. This step helps pinpoint potential hazards early, allowing corrective measures to be implemented before accidents occur. The second one is updated standard operating procedure, which is SOP. The second step is to develop and enforce updated safety procedures. This ensures that all laboratory process follow standardized protocols and comply with the latest safety regulations. Updated SOP helps reduce mistake and promote consistency in daily laboratory activities. And next one is staff training. For staff safety training, we focus on comprehensive safety training covers chemical handling, PPE use, and emergency responses. Regular refresher session will be conducted to build awareness, safety work habits, and ensure everyone remains competent in safety procedures. And the third one is waste management system. Proper waste management system is another essential step. This includes the step disposal of chemical and biological waste to prevent contamination and environmental harm. Next, the regular safety inspections. Routine safety inspections and audits will be scheduled regularly. This helps maintain continuous monitoring and yearly detection of unsafe practices or non-compliance. It also promotes accountability and ensure that safety standards are being followed daily. And the next one is incident reporting system. An incident reporting system will be introduced to encourage safety to report any accidents, near misses, or safety violence confidential. This promotes transparency and allows the organization to learn from incidents and prevent future occurrences. The seventh one is PPE and equipment checks. We will also ensure that all personal protective equipment and laboratory tools are available, properly maintained, and functional. This minimizes exposure risks and ensure every lab. And the last one is review and improvement. A bi-annual review will be conducted to evaluate overall safety performance. This ensures continuous improvement and accountability, keeping the laboratory compliant and safety in the long term. Next one. This one is implementation timeline and responsive for personnel. As shown in the table, the process start with risk assessment in the first 2 weeks and continues with updates to SOP by week 4. And the training will take place in week 5 and 6, and the waste management system will be introduced by week 7. From week 8 onwards, incident reporting and continuous inspection will be implemented. And the last one, equipment maintenance and review will continue throughout the year to ensure lasting compliance and safety. For conclusion, in conclusion, maintaining laboratory safety and compliance is crucial for protecting staff, ensuring research quality, and safeguarding the environment. Our implementation plan provides a clear structured approach from training and equipment maintenance to reporting and continuous improvement. A strong safety culture promotes accountability and teamwork where everyone plays a role in preventing accidents. With continuous management support and regular review, the laboratory will remain sustainable, compliant, and safe. That's all from me. Thank you.